Lightstone Ventures, as a San Francisco-based venture capital firm, what's the size of the fund? What kind of investments do you guys make?
Yeah, sure. So Lightstone was founded in 2012. It's a $175 million fund, roughly, focused just on the life sciences. And so within that, it's medical devices and biotechnology. We tend to target therapeutics, and we try to find companies that are going after a major unmet need.
And can you tell me about the kind of companies you've invested in that have, I suppose, gone the distance and come to fruition?
Yeah, well, they don't all work out that way, but I think we've been really fortunate to have had a number of successes. Probably most recently, we sold a company called 12, which was one of the pioneers in mitral valve replacement. And mitral valve disease is a huge problem, a huge unmet need, and we were fortunate enough to sell the company to Medtronic for about $440 million up front. And they bought the company off of 6 patients of data. So that was a real success, and I think a success hopefully for the patients when the device gets approved.
Now, Lightstone has made a big commitment to Ireland by establishing you here. And can you tell us, first of all, what it is that led Lightstone to look at Ireland and what your observations are about the scene here in Ireland?
Yeah. So, we opened an office here about a year and a half ago when I relocated from San Francisco to Dublin. And I think what really attracted us from a medtech perspective is if you look across Europe and even globally for that matter, the medtech hub and the people and the experience and the skill set here I think is really second to none. And so we were looking for a place where we could come, set up shop, incubate some companies, bring on some really strong R&D talent, some really strong senior leadership. And in order to find the right people, we felt like Ireland, given the history and track record in medical devices specifically, just made a ton of sense.
Have you made any investments yet in Ireland, or are you
still
looking?
So we've done 2. The first investment we did was a company called Fire1. So that was a company that we incubated with the Foundry, which is probably one of the most successful medical device incubators. They're the ones behind 12, behind Ardian, eValve, Concentric, just a number of really successful medtech companies. So the Foundry incubated the company. We invested alongside NEA, which is, I'd say, the world's largest venture fund, and then at the time, Covidian, which is now Medtronic. So we were able to, pull together our financing, get an idea that was really compelling to both Medtronic and, the investor group, and now we've recently hired a team. We just announced this week that we brought on Connor Hanley, John Brenton, and Fiacre Sweeney as the core, Dublin-based medtech team. So it's exciting. I mean, we're really fired up about the investment, fired up about the team, and I think it's just hopefully one of the first of a few deals we're going to do here.
And in terms of observing the scene, there's a lot of momentum. The impact Ireland's had on the global medtech scene is impressive. What kind of structural things do you think we need to probably do here to kind of keep the momentum going?
Yeah, I mean, I think there's a lot of different attributes. I mean, what I've seen here and what's exciting is that the community, broadly, both from a financial perspective and from an entrepreneur perspective, are really motivated to make it happen. They're willing to take the risk to leave the big corporate jobs and go for it. And I think that's the seed. But then from beyond that, you really need to build the infrastructure and support it, and that takes money, and that takes more people, and it takes VCs and then corporates. And if you look at all the pieces that you need, you have it here, but you just have to keep feeding it and building it and having some successes so people see that there is success stories. And then once that cycle starts, I think then it just becomes self-perpetuating.